Recording. Okay. Okay. Good morning, good afternoon, and good evening, everyone. Thank you for joining us today. I'm Dr. Merlinda Shajalin. I'll be your moderator for today. So for my introduction, I'm the outgoing Director of Medical Education and also the working group chair for the Medical Education Working Group. Together with part of my group mates here today, it is my honor to moderate this very special webinar, which is our final initiative under the Medical Education Working Group for this term. I'm thrilled to present a session that's very close to our hearts, Leadership for Junior Doctors, featuring inspiring leaders from the World Medical Association. We believe that leadership is not just about titles, it's about influence, vision, and action. And today we'll hear it firsthand from those who walked the path and shaped it for others. I truly hope this session sparks your curiosity, sharpens your leadership instincts, and most importantly, empowers all of you to step forward confidently in your own journey. We are incredibly honored to have with us two distinguished leaders in global medicine, Dr. Jacqueline Kitulu, President of the World Medical Association, and Dr. Ashok Philip, the immediate past President of the World Medical Association. Their stories, wisdom, and guidance are a rare opportunity for all of us, especially junior doctors, to reflect on what it truly means to lead in today's healthcare and landscape. Let's begin. So how we are going to move on in this is I'm going to ask a question and I'll call either Dr. Kitulu or Dr. Ashok to share their insights on the question. We have a total of only 6 questions actually, which I believe will give us a deep insight on our topic for today. For your information, this topic also was highly rated on our survey conducted under the Medical Education Working Group. And the results of the survey will be published later to all the junior doctors so that we can have future webinars under this particular topic or even other relevant topics, which was highly requested by all of you. So for the first question. Okay. Dr. Kitulu, would you like to answer this first?
No problem. I am delighted to be here.
Thank you so much. So we often think of leadership as something only for senior leaders. Can you share a specific moment in your career as a junior doctor where you had to lead without a title, and what did you learn from that particular experience?
Wow. So indeed, I think as a junior doctor, there are very many opportunities to jump into leadership, but it's never really announced. So you almost have to just see the opportunity and step into it. So as a junior doctor, I had just started private practice. And I stumbled into a meeting. It was the Kenya Medical Women's Association meeting. And I think the association had sort of been down for a bit and they were trying to revive it. So there were lots of senior doctors who had been my lecturers, been my teachers, and the kind of people you just sort of look at right up there. And during the meeting, and they were looking for volunteers to step into certain positions, interim positions before elections. I had never even I'd heard about the association in passing, but I'd never really been active within it. So, and as I sat there and listened, I said, yeah, this is something, and listened to what they had done in the past and the impact they had on women's health. And I thought, well, this seems pretty interesting. And without knowing very much, I just jumped into it. And I said, okay, I'll volunteer. And you know what I was volunteered for? Assistant treasurer. So there I am, young doctor. I don't know much. And here I am, assistant treasurer for a big organization. And I'm like, oh, okay. So I jumped into it. But I quickly learned. And I realized that there was so much that could be done. within the organization in terms of it had big projects on screening for cervical cancer for women, had a clinic running, and so out of junior doctor knowing nothing, jumped in. I was assistant treasurer interim, and before I knew it, elections were happening in another 3 months. And in those elections, I was elected chair. I was like, oh my goodness, But yeah, I stepped in as a junior. I just volunteered, and I thought it was something that met my, it was something that would be impactful, something that would improve the profession. And I just jumped in and I led, and the rest is history. Here I am now, leading WMA. Thank you.
Thank you, Dr. Kitulu. Dr. Ashok, to you now.
Okay, well, I must say that our president would have sort of leapfrogged over several levels of hierarchy and became, the top person in that. But I didn't really do that. I wasn't keen on joining. Well, I joined the Malaysian Medical Association quite early on, but I wasn't keen on jumping into the committees and getting involved in all that. But I realized that leadership doesn't have to be in a position. You don't have to be the secretary, the treasurer. What you need first is the passion for your profession, because we're talking about leadership in the medical profession. So you have to have that passion for your profession, and that has to be a passion for your patients first, and then a fellowship with your colleagues. When I was a junior doctor, and that's many years ago, before most of you were born, I would say that the culture was less gentle than it is now. Bullying was very common. So junior doctors would often get scolded. They would have the case notes thrown at them and told to get out of the ward and all sorts of things like that. And then you realize that when you have risen to a position where you're just a little bit above the most junior doctors, you can change that culture. You can protect them by standing between them and the bully, and you can train them in a fashion that is not threatening or aggressive. I really prefer, when you train doctors, the Socratic method. You ask them the questions, because most of the time they already know the answers. They know these things. So I feel that when you want to get into leadership, you have to start slowly. This is my start. Start slowly and then slowly work up. So it took me many years before I became active in the medical association. So leadership was more in my department in the hospital. And it was necessary for me to take that leadership role because my boss at the time was one of those extremely, well, shall we say, unstable people. Because he was always fighting with someone, but it wasn't always the same someone. One day he'd be scolding all the most junior doctors in his unit. The next day they would be his best friends and he'd be fighting with another department. And then on day 3, his wife would have scolded him, so he'd come and take it out on everybody. So in that sort of unstable environment, you have to protect the most junior doctors, because they have no idea what's going on. It's the first time they've come to work. They don't know whether they're doing the right thing or the wrong thing. And if you scold them, even though they're doing their best, then you're going to drive them away from the profession. So your leadership can be shown by making sure that these young doctors are led along until they have developed a sense of where they're going. And hopefully that where they're going is not out of the medical profession. So after that is when I became president, and like Jackie says, and here I am, not quite knowing how we got here, but here we are.
I must say, Ashok, when I was in medical school, it was very similar. And as a junior doctor, we were bullied.
Yes.
As a junior doctor, you were like the bottom of the food chain. And
oh yeah, the nurses will bully you. You get scolded by the nurses, and
yeah. So you learn to make
The ward
friends with
boy.
them.
yes,
The ward boy, the
yeah.
patients, the porters, name it.
Yeah.
But you make friends with all of them.
Everyone. Yeah.
Great. Thank you. Lovely answer, actually, because it resonates with all of us, I believe. Some of us just passed this era, some of us are still in this era. So both of it are highly resonating with, I think, almost all of us here. Great.
Mm.
Now let's move on to the next question. What advice would you give to a junior doctor who feels overwhelmed by the idea of leadership and doesn't know where to start? Dr. Ashok?
Well, I suppose building on my previous answer, it is absolutely up to you whether you want to take what is a formal position of leadership. But you have to remember that when you are a doctor in the ward, you're already a leader. You lead that team that takes care of the patient at your level. Once you finished your first year, your internship, you're leading a team. Your interns, your nurses, your physiotherapists, your pharmacists, they all have their roles and they are not entirely subordinate to you. But in the end, the buck stops with you. You have to make the decisions, and that makes you the leader. So even though you don't have a formal leadership training, you're not getting extra pay for being a leader, you're still a leader. And that will translate into other roles as well. You're not forced to go forward and become a leader in medical association. You're not forced to become a leader in any role if you don't want to. But I think, well, at least this is my view. When I have reached a certain position, I look at it and I think, well, actually, anyone who has similar training can do this. So you may look at the role of, say, a president of the Medical Association or president of the WMA as so far beyond you, but in fact, it is not. And I think Jackie will agree with me. These are things that you can do, but you just remember that there's always support for you. Most of the people who are around you, if you ask them, they will help you. They will guide you. They've been there before and they know what they've gone through, and they would speak to you. There are undoubtedly some who are not so kind, but I'm sure that after 1 year of your internship, you'll know who to approach, you'll know who to speak to. And you can find a mentor. It's not easy, perhaps, to approach someone, but approach someone senior in the field that you are interested in and ask them for mentorship. And even if they cannot mentor you personally, they'll be quite happy when they cannot refer you to someone who can. So you can always get support. And you always have to go at the pace that you're comfortable with. Don't think, well, this year I'm the deputy secretary, so next year I have to become the secretary. No. Next year you might become the chairman, but also next year you might just stay put where you are or make a lateral move to deputy treasurer or something like that. So at your own pace, guided by your own friends and your own principles. Thanks.
Thank you, Doctor. Great advice. Dr. Kitulu?
So, Ashok, I absolutely agree with you. Indeed, it has to follow your own path. It can't be somebody else's path, that you look at a colleague and say, oh, they have done this, now I need to do that. No. We are all walking different journeys and we are equipped very differently for our own journey. So for a junior doctor feeling overwhelmed about leadership, I think when you look at it like, maybe like now looking, how do I eventually chart the way to being WMA president? I can assure you, I never had that plan anywhere in my mind as a junior doctor. For me, I looked at it as making a change where I am. And I think I've continued looking at it that way from when I was a junior doctor. Is there something that I can influence? Is there something that I can make a change about? So and in a sense, that's leadership, you look at, you're a change maker. And you see a problem and you say, I have a solution to this. Maybe, I can make a suggestion. And sure enough, by the way, many people will appreciate someone who stands up and makes a suggestion to make a difference. Of course, there are a few bullies who will, try and put you down. But generally, people will appreciate that. So I would say to a young doctor, just look at where can you make an impact. And right now, there's so many different places. There are so many, junior doctors who are skilled in AI, who are good at writing, who are good at, so many different aspects. that's where you jump into leadership. It doesn't have to be along the beaten path of medical association. Well, it does help to be within an association because you get a network that moves you forward. But I think just look at a place where you can make a difference. Rather than in Kenya, if you're a Kenyan on Twitter, well, X now, people can really, we call them keyboard warriors. They'll type things there and why isn't this being done? But they don't step up to the table to do something. So I would say if you're a young doctor and you're seeing there is something somewhere where you can make it, just step into it, just volunteer and step into that position and do something at whatever little level. It doesn't have to be a big level, just start somewhere where you make a change, because the situations where you're passionate about something, where you're making a change, the fulfillment you get is amazing. It's got nothing to do, it doesn't have to be even leadership with a title. It's the change and impact that you make. Thank you.
Thank you so much, Dr. Lovely. Lovely. Said it so lovely. I think I need to share some personal news alongs that keyboard warrior. Actually, Dr. Ashok and myself, we are both from Malaysia. We're actually quite well known our fellow countrymen are quite well known to be keyboard warriors on Facebook. So Kenyans on X and Malaysians on Facebook, and Facebook the one that I'm quite aware of, right, Dr. Ashok? They are really, really, really vicious on social media. So I think amongst that, we have a similarity here between all three of us. We are in a country full of keyboard warriors. Thank you, thank you. Now let's for the next question. I think I'll ask Dr. Hitulu. Are you okay if I ask you?
Yeah, sure.
Madam President, what is the biggest challenge you faced in leading an interprofessional team, and how did you overcome it? I believe in WMA, it's still new. However, I'm very sure. I mean, I didn't read out your CV, but I have your CV, and so I know that you have had a lot of experience in leading interprofessional teams. So, how did you overcome it in all the challenges? Thank you.
So I think the biggest challenge in interprofessional teams is that hierarchical leadership that we have. And you know that when you stand up to lead as a doctor, then it feels like, oh, you're feeling superior to me because I'm a nurse, or you're lower than me, or the pharmacist is better, and those sort of intercadre wars. And yet we all have specific roles. And the whole system, I love to look at the health system like an orchestra. You can't have an orchestra of one instrument. You need the flutes, you need the clarinets, you need the violin, the different, and then you have a beautiful sound. So that's the way the health system works. And in there you have the nurses, you have the pharmacists, nutritionists, you have everyone, the phlebotomist, you have everyone, and they're doing their specific role to make the whole system work. So for me, I think I realized this when I was president of KMA, the Kenya Medical Association. And there was a point at which there was so many strikes going on, a doctor strike, then after the doctor strike, it's a nurses strike. After the nurses strike, it's the whole union, the union which has doctors, dentists, pharmacists, they're on strike. I mean, it was just a never-ending story. And I said, you know what, why don't we all come to the table as all these different associations and just sit together and see what is it we need to do differently. And indeed, that was the very first meeting ever that we had, and we called it at KMA, and we had the dentists come, we had the pharmacists come, and then so they're the ones who don't have major associations, optometrists and all the others, they are in another amorphous group, but we got them to come as well. And we all sat on one table and realized we're all struggling with the same issues. But where did I get that ability to bring together? It's during my training for, I'm a pediatric life support trainer. And during the EPLS training, you learn to work as teams. There is a team leader, yes, but everybody is crucial to work in the team. And that's when you realize that if I don't have a team that knows what they need to do, it doesn't matter if I'm a leader, then I can't do it all, then I'm useless as a leader. So I have to ensure that everybody knows their role and that we are all working together, then we can come into alignment. So, and that requires mutual respect for each other. It requires communication skills. It requires diplomacy in engaging. And those are things which sometimes maybe from our bullying seniors, we take up habits, like, so you're just a nurse, or you're just a GP, things, statements like that create rifts amongst us, and yet it's possible for all of us to work together. So, and I know those rifts are there globally. They're just in Kenya, they're everywhere. But I think when we appreciate and respect each other's roles and realize that we need each other, then it's possible to sort out the interprofessional challenges. Yeah. Thank you.
Very eloquently said. I highly agree. Do you, Dr. Ashok?
Well, yes, but to go further with Dr. Kitulu's analogy of the multidisciplinary team as an orchestra, you have to remember there has to be a conductor, otherwise there's going to be a cacophony. Nobody will be playing the same tune. But when we get together with other professionals to either discuss problems between our professions or common problems facing our professions, yes, then we have to remember that we are not standing above anyone. We are all working together. So in the hospital, when we are treating patients, there's a team, then the physician is the team leader. But when you are dealing with outside the hospital, not dealing with directly with patient care, and we are discussing, then we have to remember that everybody is at the same level. We cannot get anywhere by telling the pharmacist, look, you guys don't know what you're talking about. We are the ones who are going to treat the patients, so we will do it our way. That's just a way to make sure that they'll never work with you. We had that problem when I was president of the Malaysian Medical Association, because in Malaysia, general practitioners are allowed to stock and dispense medicines to their own patients. And this is a holdover from a time when there were not enough private pharmacies. So patients, after seeing a doctor, would not be able to find a pharmacy to get medicines, especially in the middle of the night. So 24-hour clinics would definitely have their medicines, and generally general practitioners keep medicines. And it's worked out well because they were able to keep their consultation fees low by cross-subsidizing with the medications. So it worked out well for the patients, it works out well for the GPs. But of course, the pharmacists don't like it because the patients might not want to go to a doctor and then go to a pharmacy. So what happened is that they tried to bring about legislation to try and stop doctors from dispensing. And there we had to meet with them, and we had to meet with the minister, and we had to meet with so many high officials in the ministries. But in the end, the ministry did realize that we're not yet ready for what we call this dispensing separation. So it was by engagement and not by confrontation that we were able to stop it. So when it's non-patient care issues, then we have to engage in a very careful and diplomatic manner. But it seems common sense, but sometimes, like Jackie was saying, the older type of physician tends to like to try and get their way by speaking louder and talking over other people. Thanks.
Thank you, Dr. Ashok. So along those lines, I think I must give a little bit of a brief intro about yourself also. I've known you for about a decade now, I think, maybe even longer than that, ever since I'm in Malaysian Medical Association. And I actually saw how, Dr. Ashok speaks very softly, like how he is speaking now, very, very softly. But he delivers a punch quite well when he wants to. So, and I did see the outspokenness in telling facts as how they are, even in interprofessional things, especially in the pharmacy line. and also some other things like the Poisons Act, our country's stuff with nicotine and all, vape nicotine and other things. So this is firsthand what I observed from him. It's true. He handled it very well, actually. So kudos, because I don't have
Thank
your
you.
CV, Dr. Ashok. You didn't give it to me. Okay, thank you. We got to go on to the next question.
But you know
In a
him for
global
a
context,
decade, so that's you're good enough.
yeah, because yeah, it's okay, it's good enough. Well, okay, next question. I'm just joking, by the way, Dr. Ashok.
Yes,
I don't want to get a punch later.
not from me.
Okay, so in a global context, why is building a professional network so critical for junior doctors? And what is one practical step they can take to start doing so right now? Now, I think probably Dr. Ashok, would you like to start?
No, okay. I mean, you don't have to wait until you're a doctor to start stepping out of your own country. A lot of us study outside the country of our birth. So you already have a step up. And then you've got the medical students associations, especially the IFMSA, the International Federation of Medical Students Associations. They're very active. I was able to attend their meeting in Greece in August. And I must say, I've never seen a meeting where the plenary sessions go on until 4 a.m., 5 a.m., 6 a.m. I mean, I didn't stay until then. I went to bed when I wanted to, but when I went for breakfast, there were people who hadn't gone to bed yet. So you can start with them. And from there, then you move on to the Junior Doctors Network of the WMA. And why is it important? It's because actually a lot of the problems that you will face in your career are not new. They have been faced and overcome in other places at other times. So you don't have to reinvent the wheel. You just have to be able to reach out to an association like the WMA, which has so many policies, statements, and resolutions covering so many aspects of the medical profession and medical ethics, from very high-level documents like the Declaration of Geneva, the Declaration of Helsinki, right down to statements about volunteering medical care on a flight. So very specific or very general, but you'll always find something that can help you. So instead of scratching your head and wondering how you're going to go through this difficult time, look at how others have done it before. And I think it's not just that practical benefit, but also building friendships across cultures and across countries is rewarding in its own right. I'm sure all of you have that experience of meeting people from other cultures, other countries, and discovering not only what's different about them, but also what is so much the same about all doctors. And I think you'll find that a rewarding experience just in its own right. Thanks.
Thank you, Doctor. I highly agree. As someone who's been here, I think this is my first international exposure, and yeah, it really is enriching to know about other people, especially my visit to Kenya. Dr. Kitulu's team, they were extremely. I think they were generous hosts. They made the entire event lovely with their presence and all. And that's a memorable event that I'll keep for my life, my whole life. So, yeah, I completely agree with what you just shared. President, your turn next.
So, and Ashok, I absolutely agree with you too. I started, I think, some of my journey also within AMSUN, which was the Association of Medical Students of University of Nairobi. And from there, already you already get interested in a group of people with similar ideas, and the advantage of being within a network is that then you have a louder voice. As an individual, it can be difficult sometimes to make a change somewhere. So you're within a professional network. There you are. You already have a voice. It opens up opportunities for you. There were many conferences which AMSUN opened up opportunities to engage in FAMSA. FAMSA is the Federation of African Medical Students Association, and then, of course, IFMSA. So suddenly it just opens up your horizon. And as Ashok said, you realize the issues you're dealing with are very similar. And then you also discover that, okay, this area, this country have dealt with this situation that way. You're like, oh, there we are. We have a solution. We don't have to think from scratch. They've done this. It worked. We can give it a try. And that's part of, even within my presidency, some of the things I've said, I really want to work on interregional collaboration, because there's so much that we can benefit, that you don't have to start from the bottom. It's been done. I mean, for those who read of the Bible, it says there is nothing new under the sun. It has been there, and will always be. There'll always be something. So if things have been done, if you have a professional network in which you can dip into, then you get to learn, oh, the solutions for this, the solutions for that. We can try out that, and then you also share your own. So it becomes a learning experience for everyone. And then you're better able to deal with the global challenges, which you realize, indeed, they're not limited to one area. They tend to be just sort of universal problems that we engage with. So I think for me, networks, very useful, a very useful voice, especially, and especially like junior doctors, you're wondering, how do we get our voice heard? It's within that association that your voice becomes, amplified, and you're able, and then that's how you jump in as a leader into there, and you're like, okay, these are the issues that I'm bringing up, and then your association amplifies it, and it grows. And yeah, Dr. Melinda is then next, we are looking a few years down the line, President WMA, so why not? Thank you.
Sorry, it was.
Yeah.
Am I audible?
You must have glitched. Yes, yes, I'm done.
Yeah, okay. I had a glitch just now, sorry. Well, I'm not sure about that, but thank you for the thank you for your confidence in me. Well, now, Dr. Ashok.
Yes, yeah.
Hello, can you hear me?
Yes, I can hear you.
We can hear you very well.
Yep, hear you, see you.
Okay.
Can you hear us?
Can you please repeat the question, Dr. Melinda?
Okay. Sorry. In a global context, why is building a professional network so critical for junior doctors? And what is one practical step they can take to start doing so right now?
So that's the question we just answered.
We just answered that, yeah.
Oh, sorry. Sorry. At what point in your career did you realize you were becoming a mentor yourself? And how has mentoring more junior colleagues changed your own approach to leadership? Who would like to answer that?
Becky, would you like to go first?
Sure, I can go. So when did I realize I was becoming a mentor? That's a good one, because I think as you at each step you find you move on to second year, and there are people in first year asking you, how did you get through this? How did you do the other part? Can I borrow your notes? Things like that. That's where mentorship really starts. You've been the path, you've gone the path ahead, and you can share some tips of how it became, how you went through a difficult patch, how certain things were easier. And yeah, so I think mentorship, started right at the beginning of med school for me, in terms of, I reached out to those who are ahead of me where I was stuck. And when I moved the next year, it became my role to help the ones below me. And I think for me, it has been a really a big change maker. And that mentorship, the mentoring component has been a big propulsion into my leadership journey. Because even as I mentored others and others mentored me, there are those who picked me up and said, I think you can do this. And I'm like, I don't think so. And they're like, no, you can absolutely do it. I'm choosing you to do this or the other. And in fact, one of them was when I started my first job, after my internship. And as I got into the job, they said, we're going to appoint you to be the clinical manager for the clinic where you'll be. And I was like, I'm so new. I'm not even sure what I'm doing with patients. He said, no, I think you'll be good at it. And and he said, and where you have questions, ask. And there are all these other doctors who are there, who have been there before you. They'll be able to support you. And that's really what it is. Someone sees potential and is able to point it out for you, because sometimes we don't see our greatest attributes in ourselves. Someone else, maybe they're internal and you need someone outside to be able to view it and be able to pull it out of you and make you see what it is that you can do. And so I've continued in that journey. I've mentored people in high school, in medical school, those who are junior doctors, and I have been mentored by the same, those across. And now I've realized that mentorship is not necessarily from senior to junior. It's actually cross-directional. The past WMA chair, Dr. Marie Claire, she has been an amazing mentor for me in terms of writing. She is an amazing writer. So, where I need certain research on things, she said, oh, I'll get you the research and that in minutes, So, you find that you can learn from the junior doctor, and you can share your experience as a senior doctor. So I think there is a lot of cross mentorship that can go on, and I'm really thinking that as junior doctors, that's an area that really we should go, even within WMA, because then it enables us to grow the pipeline for leadership. Because there are those who are very dedicated, and you'll find and that's how sometimes associations slow down, because the dedicated older persons are very much there, but there is a gap between them and the junior doctors, especially if they were bullied like Ashok and I by our senior doctors, so there's almost this divide, and then there's no merging in terms of growing that sort of leadership journey. So mentorship is an everyday thing. It's a continuous thing. If you're not being mentored, please find a mentor. And as Ashok said, find someone who you admire, what they are doing, and you want to learn how it is to move from there. But when you're also looking for a mentor, know that it's your business to look for them and to find time to get them down. Because usually a good mentor will be a busy person, but they will be willing to also give you of their time to make you into what they see you can be. So it's something that we just have to do. We must do if we are going to continue our profession in the way it is, and it has to grow. So yeah, that's I think a bit about my mentorship journey. Ashok, over
Thank
to
you,
you.
Dr. Kitulu.
Thank you. Yeah, well, when I started my internship, it was, I think, very different from nowadays. So it used to be said, for all procedures in the ward, you see one, you do one, you teach one. So you don't exactly finish your first year, you finish your first week, and then you start teaching those people who have come in later than you. So not just setting lines, but also lumbar punctures, pleurocentesis, anything. Central lines, all those things, you see one, you do one, and teach one. So you become a mentor in that sense. But I note, just to go to the World Medical Association, normally I would have just attended one meeting and then never gone again. But when I went to my first meeting in Moscow, I was appointed to a working group. So I had to keep going. And then after that, I was appointed to a committee, and then I had to keep going, and then I was appointed to chair a committee. So this sort of trust placed in me was also a form of mentorship. They didn't direct me in any direction, but they said, we think you can do this. Please do something about this. And that's also a form of mentorship. It doesn't have to be guidance. It just has to be placing some confidence in you. And that, I think, has also changed my life in many ways. So you don't always have to go look for a mentor. You don't always have to have a formal mentor-mentee relationship. People may be guiding you every day of your life without even knowing, without you knowing, without them knowing, and somehow you end up in a different place. So I think you should just trust that it'll all work out in the end. Thanks.
That's the process.
That's the process. Thank you, Dr. Ashok and Dr. Kitulu. So we've had two ideas from this now. One is that we have to find a mentor, one, be a mentor along the same line. And another is we have to trust the process, so that we have to take it as we are being mentored by the universe, right? Great ideas. Actually, I've never thought about it that way. But yeah, that's really something profound. So for our last question that I have prepared, and after this, I think since we have time, so we'll move on to the chat box. There are a few questions there already now. So for those who have been on this leadership path for a while, what is the key to staying passionate and avoiding burnout over a long and demanding career? So I think Dr. Kitulu, do you please, followed by Dr. Ashok next. Thank you.
Yeah. Well, that's always the challenge, and that's where that conversation of work-life balance comes in, and really, I think now we call it work-life integration, because you can't have 1 kilo of work and 1 kilo of rest, and it doesn't work out that way. But how best do you put them together? And I think for me, what has worked is realizing what are my priorities, in terms of what it is that I do. That in my work, I'm passionate about my patient being, looking after my patient, right? Because I still do practice. I'm passionate about the profession. In how is the profession viewed? What is the profession doing? And so I will put my energy into that. I will sit on boards that ensure that the professionals in hospitals, in health institutions are well looked after, and that they are allowed to be independent to do what they should do. So again, following my passion. But within that, it's important to remember that that is my work that I do on a day-to-day basis. But where do I come from? I come from a home. I come from a home where I have a husband, I have sons, I have family, I have people who hold me and support me. And those people, and indeed, for those who were at the inauguration, so my huge family who came from all over to be part of it. And there in Africa, we say it takes a village to raise a child. And maybe that's why maybe we are able to juggle a little bit more, because everybody takes a little bit of helping you do certain things. But it's important then to also to prioritize also that within this work that you do, and do so well for many others, to do also for your own family. So what did I do when my kids were younger and I was KMA president and I needed to travel a lot? I would travel with them along with my husband. And they would make a holiday of it, and I would be working. But at least we'd catch up in the evening, and some points where there was a time of engagement, would go out together. And then they also got into my life, and they were able to see what are the things that mom does. What are these things that she's so passionate about? And indeed, I think some of they chose never to go down the medical route, unfortunately. So one's a computer engineer and the other's doing architecture, but they're like, no, there's too much work in your profession. But so incorporating that. But then also for me as a person, then is also finding space for me. How do I build myself? In terms of how do I build my resilience in terms of I've worked so hard, where do I get my downtime? So I have a group of ladies that we walk with at 6:30 in the morning, and we do an hour's walk and do like 5K. If it's a day when you're not starting too early, can do a longer walk. And it's a good place to be outdoor and exercise and refresh and just talk about anything under the sun. It doesn't have to be anything medical, because we are all from different areas. So exercising, eating right, the things that also just ensure that you're healthy enough to be able to do the things that you need to do. And ultimately for me, it's also just knowing that that there is a higher being than me, that I do all these things not for fame for me, but because I have been put in this world to make an impact in this world for the people of this world. So if I have been given certain tools and certain skills, then I should do it well. I should do it for my family, for the people of the world, and for myself also to excel within it. So yeah, those are some of the things that I look at in terms of refreshing myself and avoiding burnout. Making time for friends. Ashok, over to you.
Thank you, Jackie. Yes, I have to agree with what you say. Family, friends, physical exercise, all these things are important. But I think in our profession, it's very important that you have a passion for it. If you don't really love medicine, I think there's no way you can avoid getting burned out. I have seen young doctors join the profession. I remember one guy, his first day as an intern, he was good. He had the knowledge and he had the skills and he had everything. And he joined us. And I said, okay, look, you just join us, follow us around until about midnight, then you go back. And he followed us and he saw, different procedures. And then the next day he came to me and said, I'm not going to be a doctor. It's not for me. So after 5 years of studying and all that money that his parents spent, he decided he's not going to be a doctor. And this has become more common now in Malaysia because for a while there, the government expanded the number of medical schools and almost everyone could become a doctor. So everyone's parents were saying, okay, you're going to be a doctor. And the child had no say in it. And so after 5 years, 6 years, they're doctors, but they don't want to be doctors and they cannot do the work. They just cannot work from 7 a.m. until 7 a.m. the next day and then continue until 5 p.m., which is what most of us do. And worse still is their parents, The parents will come and be waiting in the car outside at 5 p.m. And when the child is not out by 5:10, they'll go inside. Why is my son still working? It's 5 o'clock. It's time to come home. So these are not the people who are going to find work-life balance in our profession. No way. Because, as you say, Jackie, it's not really balance. It's integration between the two. You have to be able to escape for a while from one to the other and back again. And of course, it really helps if you have a supportive partner. And I mean, your husband's not a doctor, but for me, I find that for a doctor, it's much easier if you marry a doctor or a nurse. They understand what you're doing. So, but it's not absolutely necessary. You don't have to get married. You can just have your friends, your support network, but make sure that you are passionate about what you're doing. And if you find out halfway that this is not for you, don't force it. You have to go and do something else. It's never too late. If you keep pushing because this is what my father wants, or this is what my mother wants, or this is what society expects of me, then that is not exactly good for your mental health. And you are definitely going to burn out. Thanks.
Thank you. Thank you. A lot of tips here actually. So then I've done a few things right then, taking points from what you said. A good husband, good friends, village, working on the village. Passion is already there. So I think from the 4 points, I just have to settle the village part, and then I'll be good. All of us were nodding. I can see some of their cameras. All of them were nodding. Oh, oh. Really lovely points actually. And yes, so we have time. Great. So we are ahead of time. So may I please ask a few questions from the chat box with your permission? Sure. Thank you so
Yeah,
much.
sure.
I like the latest question from Jorge, I believe the name. Jorge. I believe trust in doctors and leaders relies on their prestige. So what actions or errors that you experienced should we avoid? Very deep, insightful question, actually. Thank you, Jorge. Dr. Ashok, would you like to start, followed by Dr. Kitulu?
I think prestige comes from trust, not the other way around, really. And trust only comes from your actions. Your words and your actions have to be concordant. You can't say one thing and do another. And nowadays, it's so easy when social media and cameras are everywhere for you to be caught out, for you to be doing something that you shouldn't be doing. And So it is more important than ever that we are sincere in our words, in our actions. We don't try to put on a facade. We just speak politely but sincerely and stick to the facts, stick to the, well, to the etiquette of addressing other people. In communication, there is a principle of sympathy, which basically means that you assume the other person is trying to make sense. But there's also the principle of charity, where you give the other person the benefit of the doubt, put the best possible interpretation on their words and on their actions. So if you do that, and then they will see your sincerity and they will reciprocate. And that will make you more of a leader, and that will raise your prestige. I think actions definitely speak louder than words, but actions and words have to be pointing in the same direction. Thank you.
Mm.
I think, Ashok, you're literally speaking to what authentic leadership is. It's not the prestige. It's that being genuine, transparent, acting in alignment with your core values, and it's about that passion to make a change, for that patient and the whole ecosystem. And really, and that's what builds trust, because patients also can see through you. If you're saying this and you're acting another way, they can see through it. So it's and that prestige indeed will come from that authenticity, that patients can see that this is a person who I can trust, and I know now, I'll always refer to them because I know I'll get the best information about what's best for me. I know sometimes people say, yes, becoming a doctor is prestigious. I'll earn good money. Yes, you may earn good money, but there's so many other frustrations behind there. And as Ashika said, if the passion is zero, it will be the most frustrating money you'll ever earn. And there's no prestige in that, when you're frustrated and burnt out and distressed. So I think that motivation by a deeper purpose to create those meaningful relationships with your patients, I think those are the things that will enhance the trust and will give you prestige that doesn't come from money. Actually, that doesn't come from the money. Yes, we do need the money. You don't live in a house for free. You're not going to drive a car for free. So you do need money. But I think beyond that is more of the trust you build with that patient. Yeah.
Thank you. Thank you so much for both of your very insightful answers. I believe the takeaway is align your words and your actions through authentic leadership, and that will build trust, and that then will build prestige. So I hope, Jorge, your question is answered. Next question. Oh, Jorge is very happy. Passion, coherence, authenticity, brilliant answers. Thank you very much, he replied. Okay, great. So next question from Shiv. What are 2 or 3 concrete leadership behaviors a junior doctor can use tomorrow? Why not today? Anyway, tomorrow, to build psychological safety on the ward, especially when time is short and hierarchy is steep. Dr. Kitulu, you first, and Dr. Ashok next. Thank you.
Yeah, that's. I think. Yeah, that's always clearly that question seems to infer that what Ashok and I thought we were facing continues. Hierarchy is steep, but I think a lot of it comes with know your stuff, and confidently speak up to what it is. You can imagine if you're coming into a ward round and you haven't read, you don't know about your patient, and you're just there blubbering around, and it just winds up your consultant. So and even where you may know part of it and may not know all of it, but if you speak with the confidence about it, I'm confident, okay, I may not be too clear about this other part, and because we also have to admit you're a student, you're learning, so you can't know it all. But that confidence, even to just step up and say, yeah, I know up to this point, this part I am not so clear, and it's that confidence that I am doing the best I can. I am and I'm willing to learn. I think that those are things that I find very critical. I've noted indeed with the Gen Zs. My children are Gen Zs, and I think many people here maybe that Gen Zs actually do speak up for justice, for fairness, and which is very important. And those are concepts sometimes maybe as older doctors we may struggle with, especially when someone says, that's not a fair a situation that you've created there, and we may find it like, oh, are you trying to, are you stepping out of line? But I think it's a sense of how do you do that diplomatically, in terms of getting that that understanding for the one who is higher up in the hierarchy to see that, this situation looks like that. And that's how you build leadership skills, by the way, all along, because you'll always find a situation where you have to engage with those who are higher than you or which other, different levels, but you have to get the message across. Yeah. So communicate with diplomacy, communicate, and always with clarity and with confidence and yes, and a willingness to also listen and learn from the other side. Yeah, Ashok.
Thanks, Jackie. Yes, I strongly agree with you. We have to be able, well, first you have to have the knowledge, then you have to have the ideas, and then you have to be able to communicate them. And really, psychological safety depends on an environment in which people who are working there can speak out about issues that they see without fear of being victimized or harassed. I was at a ADB meeting in April, and they were basically speaking about patient safety, but they asked me to speak about psychological safety of health workers. And there were also people from the World Union of Nurses and other associations, and they all said that the hierarchy does not really want you to speak out, because every health system in the world is under some form of strain, has some problems, and they don't want you to point out the problems. They just want you to keep doing your work and pretend that the house is not burning down around you. But we have to be able to speak up. And I think if a junior doctor tries to speak to the senior doctor, he is going to need support from his cohort and from the people above him who agree with him, or at least agree that he has a right to speak. So old people like us have to learn to listen, and young people must not be afraid to speak out. Psychological safety is not guaranteed, but there is safety in numbers to some extent. So make sure that you have a network to support you.
Thank you. Thank you so much. So much of tips today. It's really, I'm really glad I went down this path, to take some wisdom from both of you before I end my tenure. And I believe the tips, I mean, there's not enough time to write. I am recording, but that's not enough time to write. So much of wisdom in one session. I'm so glad to have both of you here. Okay, next question. Lian from Malaysia. Sometimes in our journey, we may bring up and advocate for issues that may be directly or indirectly related to the treatment or perception of our superiors, perhaps due to the generational gap, for example. How do we, as junior doctors, address these issues without overstepping our boundaries while still maintaining respect for our veteran doctors? Dr. Ashok, Dr. Kitulu, any one of you can go
Well,
first.
Perhaps I can just tell Leanne, please don't put it on social media. You have to still go the traditional way, step by step. Try speaking directly to your boss. If you feel that you can't, then speak to just the person just above you, get their advice, and slowly work your way up. But definitely not snide remarks on social media or TikTok or whatever. Jackie?
Absolutely. I think this calls for emotional intelligence. And, you have to just know, who am I dealing with? There's your senior who you can, just approach and they'll take it. And there are others who will want you to be approached in a very different way. So, and indeed, I think businesses are now saying EQ beats IQ in terms when they're recruiting. They want someone with a higher EQ than an IQ. And because IQ, all of you here have very high IQ anyway. So the differentiating mark will be the EQ, the emotional intelligence. And that's something that we need to build. We are not all emotionally intelligent, and it's something that you can build. There are books around it. There's, online courses around emotional intelligence. That makes a world of a difference.
Thank you. I believe the thing on social media is very funny because it's what's happening. So that's really very funny. Okay, I think Lian has given thumbs up, so she's happy with the answer also. And we have one. Okay, another question. Mike from Samira. My question is, what's your advice for junior doctors just starting out with difficult seniors or leaders? And how do they take their own initiatives when dealing with fellow nurses, pharmacists, and even patients when they don't necessarily agree with the approaches being used or implemented in their hospital? Dr. Kitulu, would you like to go first, followed by Dr. Ashok?
Yeah, I think it goes back to part of what we're discussing about an interprofessional, engagements, and really about mutual respect for each other's roles, and communicating, appreciating that each person knows their area. And yes, there is a team leader, and that but also appreciating that there are also different ways to do things. So one may look at one direct path, and I think, like, working with nurses, I've realized nurses can be very streamlined. It is this way. It's step 1, then step 2, then step 3, and you can't jump to step 4 if you've jumped out step 3. And sometimes doctors don't necessarily want to go that direction. But I guess it's appreciating that we can see things from different points of view, but where do we end up at the end of the day? Is it where we need to be? So I think a big part with engaging with it is just that mutual respect and listening to each other and hearing. I think what Ashok was saying, that sympathy that the other person is probably right. So how do I hear and listen to them that they are right, and adjust my worldview? Because you can't be 100% right, and not everyone is. So there's always those variations. But I think when you come from a point of appreciating that everybody has a role to play, that I can't do it by myself, it becomes much easier to appreciate, to engage with the different roles. Ashok?
Yeah, thanks, Jackie. I strongly agree with you. I was going to say much the same thing. It's possible for two people to be right at the same time. And it is quite possible that you think that your boss is doing things the wrong way, but this is something that has evolved over decades, probably, the way that they do things in that department. And so they have responded to things that have happened in the past and built systems that can handle those. But things are changing now. You might have to change the system. But please do consider that as Jackie said, you might be wrong. So don't get angry with your boss. Just speak. And if you start a discussion rather than a critique, you can often get further. Instead of saying, look, you're doing this the wrong way, I think you should do it like this. You say, why are we doing it like this? And are there ways that we can do it so that we don't get these problems or get stuck in these bottlenecks? That is a much more, I think, productive way to do it. Discussion with the open acknowledgement that you may not actually know everything, you may be wrong, but you just want to discuss this matter, then I think you can get a lot further than being dogmatic and preaching sermons. Thanks.
Actually, Ashok, in management, they say how to manage your boss.
Yes.
You have to learn how to manage your boss, because you'll have different bosses at different times, and you have to learn how to manage them. They're the ones who are supposed to be managing you, but you also have to learn how to manage upwards in a way that ensures you get what you need. So these are the things which are not taught in medical school, but you have to learn.
Yes, yes. Definitely not taught in medical school how to manage your boss. And I've read somewhere that it says that you have to learn how to talk to your superiors, because at any point of time in your life, you will always have superiors. You will always have people ordering you about, even if you're 100 years old, somebody is there to order you about. And it's very important to learn the skill of how to talk, how to negotiate, how to handle anyone in a superior position to you at any point of life. So these tips also are really practical, and it brings insight from what we call senior doctors, right? So it's really enlightening to see that everyone actually has about the same um, agreement that we should have mutual respect for everyone. And from there, it's better to have a proper discussion. When it might not work, but at least better to start with that. I think we are at the end of our webinar already. We have already gone past several minutes. My apologies for that. It's just that the questions were too good not to ask. So thank you very much to both our speakers for today. Thank you so much for agreeing to be here today on this webinar. For Dr. Ashok is pretty late, and for Dr. Kitulu, she might be in the midst of work, and she has taken time away for us to share these wisdoms. So thank you very much for the bottom of my heart. I really appreciate it, and I agree. I think all of us would agree the same too. And I just would have one final question. Very briefly, I think we should end with one last message from Dr. Ashok and Dr. Kitulu on what you feel like at our participants today. And actually, this recorded, it will be uploaded later to WMA JDN page. Therefore, what you say today will be there for many years to come. So one final message from the both of you on something that must be remembered by a junior doctor in terms of leadership. So that's all from me, and thank you very much again. Dr.
Well,
Ashok
first of
first
all,
then.
thank you, Melinda. And telling us that our words are going to be recorded is a great way to freeze everyone in their tracks, But I want to tell junior doctors that you don't have to worry about becoming leaders. In WMA, I've noticed that the junior doctors are doing a great deal of work. We really are very happy with their work, and they do a lot for us. And I think we wouldn't be able to do half the work we do without their assistance. So just stick with the junior doctors and you're already leaders. Thank you.
Thank you, Melinda, for the invitation to be in this meeting. I wouldn't have missed it for anything. Seeing as mentoring of junior doctors is part of my agenda, I wouldn't have missed it. But what are the things that I can say? As junior doctors, you are not leaders of tomorrow, you are leaders of today. This tomorrow part, it's today, it starts right now. So, and in whatever role you are already going to be a leader right there. Step into those spaces, volunteer into spaces, because that's how you grow. And find a mentor someone. It's not enough to be mentored when you're not mentoring someone. Mentor somebody, get mentored, and just give yourself. I mean, as a doctor, you already start with a high IQ. You're a highly intelligent person. The world is your oyster. So it's for you to just be the change maker. So you go for it, junior doctors. You can do it.
Thank you so much. That was very warm to hear that from both of you. One more minute. Let us take our picture, group photo. So everyone, please open your cameras and bigger smiles. Dr. Ashok, bigger. So I'll do the honors of taking the picture. And Venkatesh, if you could just support me on the other side. Thank you so much. Venkatesh is always supporting me, so he's the go-to person for me. Okay, now everybody's in. Okay, big smiles. 1, 2, 3. Okay, give me a moment.
I see some cameras coming on now.
Yeah, should always give some time for them to on their cameras. Okay, I need to participant view. I can't put all of them in. I'm not good at this. View. Okay, found it. View multi-speaker. Yeah, got it. So, okay, everyone, big smiles. 1, 2, 3. And one more. 1, 2, 3. Okay, thank you so very much, everyone. Have a great morning, evening, and night. Good night. Bye-bye. Signing off.
Bye-bye. Bye-bye.